Welcome, everyone. Thank you so much for joining us for this next episode of Aestique Plastic Surgeon Secrets to Looking Your Personal Best. We're going to be waving that magic wand today and talking about fat transfers for sculpting your face and body. Are you someone that has some fat in an area that you would love to get rid of and put it somewhere else where you're a little bit deflated? If you said yes, then you are in the right spot. We are going to share all of our secrets today on fat transfers. So today's purpose will be answering the most frequently asked questions about the fat transfer procedure, how the procedure originated, how it's performed, how long does it last, and where else can you use this fat? Where can you put it in your body? So joining me again today are board-certified plastic surgeons, Dr. Theodore Lazzaro and Dr. Linda Camp, and I want to give them a very warm welcome.
Hi, I'm Dr. Theodore Lazzaro. Welcome to an exciting new procedure we are now performing and we're going to discuss with you.
Hi, I'm Dr. Linda Camp, also board-certified plastic surgeon at Aestique. Looking forward to sharing about the wonders of fat transfer.
Thank you both so much. We appreciate your time and your information. So getting us started is going to be Dr. Lazzaro talking about the desired facial shape and how we can achieve that.
Looking at this picture, it shows a heart shape. And if you look at this closely, the blend from the lower eyelids to the cheek comes in a nice smooth manner, and it goes down towards your jowl area and chin in a tapered fashion, which gives you an essential heart-shaped appearance. And this is what we're striving for when we're going to try to shape and sculpture your face.
One of the most common questions that people want to know is, how did this procedure originate?
This goes back long times ago in the Elizabethan period, to where they used to take fat and from different parts of the body, the buttock, and use it to enhance or shape the breast. Well, the techniques were not as refined then. So a lot of this, which initially looked good, disappeared after a short period of time. Now with increased technology and increased science, we have found ways that we can maintain this area. And what the stimulus was really a different types of chronic diseases, one being AIDS. Where this was a wasting type of disease where you lost subcutaneous tissue. You would be healed from the problem, but you still had the residual. And this is where we started looking a lot on, and I'm going to give you an example here in this next patient. This gentleman was cured from his AIDS. He does have a bit of a deflation to his face. He had placed in cheek implants and a chin implant to help with that deflation, but still wasn't happy. And actually, I saw him as a patient, and his main concern was maybe taking some of the puffiness from around his eyes. Well, with this tool that we have of sculpting the face, we actually said taking that away would make you look more withdrawn. So we started doing the opposite, of instead of subtracting, adding fat to the face. So we added it around to his lower eyelids, to his cheekbone and his jawline, and this changes the whole entire appearance. And you can see he has a younger, more youthful, more vibrant look. Looking at him on profile, you can appreciate the same thing. Here, again, withdrawn, here, full. And the beauty of this is your own material. It's taking your own fat, putting it in, so there's no allergy to this, no rejection. And the other great part of it is the majority of this is permanent. So now we would take these tools, having found that knowledge, and use it in other instances. For instance, this young lady almost looks like her eyes are bugging out of her head. She has tear troughs on the bottom and puffiness. She has flatness to her mid-face. And what we want to do, years ago, we would do a blepharoplasty and try to decrease that appearance. Now what we're doing is the opposite. We're adding to the area. So we're going to take fat and through a needle prick, put this in to her lower eyelids and mid-face. And here she is afterwards. You can see she gets a much softer look. That desired shape of a heart shape we're restoring. We're blending from her lower eyelids to her mid-face. Her cheekbones are a little fuller, which gives her more of that heart shape appearance. And here she is on a 3/4 view. So the tool gives you a sculpting modality that we didn't have before.
And she looks wonderful. She definitely looks much more rejuvenated and rested, and I'm sure she feels a lot better. So Dr. Camp, question for you. Another common question we get asked is, how do you get the fat?
Well, Brianna, this is actually when we get to wave that magic wand. You can see in this picture, we have several tools that are called cannulas. And when we harvest fat for replanting in a patient, it's very different than a common known procedure called liposuction. With liposuction, we use different cannulas. Our goal is to remove the excess fat. However, when we are planning to put the fat back into the patient, we need to harvest it in very gentle technique and through these much smaller cannulas. So the incision we use to use these cannulas is very small, 3 millimeters, probably half the width of your little fingernail. And through those little port sites, we can harvest fat. And the important thing is we get to take the fat from areas that you don't like, such as that lower tummy bulge that most ladies have, sometimes from the inner thighs. We can even take from the hips if that's an area where you have excess unwanted fat, and take that fat and use it where we need to plump you up, face and breasts and buttock.
So now that we know where you get the fat, how do you put the fat in?
So this is even better. When we use fat to plump the face, or anytime we're going to replant that fat, we call it liquid gold. We know that using specific techniques where we put little strands of fat that's surrounded by your healthy tissue, that the majority of that fat is going to be transplanted there and take up living there and last there as a permanent product. Variable amounts will take depending on what surface area we're treating, how much blood supply is to that area. But this technique is also done through just little needle punctures, oftentimes not even needing a suture to close the little hole that's used to put the fat into different places throughout the body. So really awesome things in the field of plastic surgery.
All very exciting. So we heard before, Dr. Lazzaro, you said that in the Elizabethan era, most people were doing it to put the fat in the breast, but are there other places that you can put fat?
Yes, absolutely. And again, as the technique has improved, it isn't a matter of putting, this is very technique dependent. You thread this in like planting seeds in a field, just very, very gently and very individual compartments. So now you can use this fat and transfer it and change and sculpt different areas of the body all over. The face is a common area, the breasts are a common area, the body, some deformities from injuries or birth defects. So let's go through some of these. I'll give you some examples. Let's start with the face. Again, as we looked at our ideal position that we're trying to create is that heart-shaped face. Let's look at our first young lady who's an attractive young woman. I was doing a different procedure, actually a breast augmentation, and she asked me about a tired look that she felt she had on her face using different makeups and different things. She couldn't camouflage it. She felt she had more of a tired look beneath the eyes. And if you look, she doesn't really have the heart-shaped face. Cheekbones are not quite as full, and it doesn't give you that heart-shaped appearance, and she gets a tired look. When you look closely, like it is on most parts of the body, one side is not identical with the other. Her left side of her face She has a little more prominence to the cheekbone and eye than on the right. So we're going to use a little more of the fat on the right side than the left. And this fat is very heavily stem cell laden. So when we take it out, we prepare it, remove the red cells, white cells, remove fibrous tissue, and we get an area that we can inject through a very tiny cannula, as Dr. Camp mentioned, through just a needle prick. Here she is afterwards, and she gets a more rested look. And you take someone who was attractive before and actually have her look like a model, because now we've converted her into that ideal heart-shaped face, fuller on top of the cheeks, nice blend from the eyelids, and this is her on a 3/4 view. So using this in other parts as well, let me go on and we'll talk about in other locations and using it in the breast. This young lady just wasn't happy with the position of her breasts. She thought she didn't mind the size, she just didn't like that she was full. And you can see even in her, by her axilla, her armpit area, she does have some redundant fatty tissue. So what we did is lipoed her there and then just did a breast lift, nothing else. When we lift the breast, we decrease the size of the skin container, and it gives her a more uplifted look, leaving the same amount of breast tissue. This is her from the front. This is her from the side. I think we have, no, we don't have a side view. Oh yeah, we do, front and 3/4. What happens is she was very happy from where she was with the sagging with just the lift. And she said, you know, I just like to have a little more fullness up on the top, a little more in the cleavage area. And if I can possibly do this without having an implant, I'd like to see if that's a possibility. So we actually took fat now from another part of her body and just filled up the other upper areas. And you can see it gives her more fuller breasts. Now, it depends on how full the patient wants to become. This was just, she was happy with her lift, but just wanted to be a little more full. You can't get it as full as you can with an implant, but you can see, you can contour, and with that combination of the lifting and filling, you get a nice aesthetic result.
So there are other parts of the body where we can transfer your own fat to give improved shape and plumping. And this patient represents when we do fat transfer to the buttock. A common name is the Brazilian butt lift, or the BBB. You can see this patient on the left picture has significant fat in her muffin top area, above and lateral to the tattoo. And so we want to harvest this fat where she has excess and give her a more feminine shape to the waist, and then use her own fat structure to complement her flat buttock. And so after the fat transfer, we can see her here on the right-hand side with a more shapely contour to her waist, upper buttock area. And when we look at her on the side view, we can see how we've improved the contour of her gluteal mass area and given her that nice curved S shape that we think is lovely in a young lady. But fat transfer can be done for other things too. This next picture shows a patient who has congenital deformity. This was a birth deformity, and with fat transfer, we can see on the right-hand picture that some of the deficit of tissue, he also had surgery there. You can see the scar on his neck. But from the deficits of removing a congenital tumor, we are able to give plumpness to the cheek and give him better symmetry for this deformity. It can also be used in patients with trauma who have tissue loss and need better shape to give more uniformity to their contours. It can be used for small divots for patients who've had maybe a cyst removed on the cheek with a depression deformity. We can add fat to that area to give a smoother facial shape. people who have chemotherapy ports and the ports removed are left with depression deformities on their chest wall. We also do fat transfer for breast reconstruction. And this is a very common procedure. You can see this patient on the picture A, very full pendulous breast. In picture B has had a bilateral mastectomy or breast and nipple areolar complex removal. This was done with a standard WISE pattern. And then on the far right-hand side, after her fat transfer and nipple reconstruction, she just has achieved a beautiful shape and contour.
And another question, we talk about being able to use this fat, but how long does it last?
That's a very common question, and this is the other benefit of this that is so exciting, and you can see why we as plastic surgeons are so excited about this. It gives us a tool that we can now take fat that people don't want in locations and sculpt that as we would do in a liposuction, and then use that area, so we've improved their contour in the place they didn't like, and place it and resculpt somewhere else. And 2/3 of this will be permanent. Let me show you a case in point here. This young lady who had what we were talking about does not have that ideal type of look and that desired look for the heart-shaped face. She's a young, beautiful woman, and she gets a tired look, even though she's not tired. She said, I would come into work and people say, were you up all night? And she said, no, but obviously she's trying to use makeup and camouflage. She has that tear trough. You can see the difference right around where her eye is, and then there isn't a nice gentle blend into the cheek. So here, these pictures that we're going to show you here next, this is her 2 years after we did the initial procedure. So she still maintains a nice heart-shaped face, has still a good blend, and it is 2 years after the initial procedure, but this is the beauty of this. And she even gets almost more of a glow of the skin. And there she is on a 3/4. So it does last. Sometimes you might have to go down and maybe put a little more at 2 years' time. I haven't seen that come up, but sometimes. Can you do that in a year? And the answer is absolutely yes. And you will get another 2/3 of what you put in that will be additive to what is there already.
We have a good question coming in. What is the difference between putting the fat in your face versus a filler, a dermal filler?
That's a very good question. The dermal filler, you can do and you can create this type of illusion as well. And at our medical spa, we have excellent practitioners, PAs and nurse practitioners who are really expert at this. So the benefit of this is you can go in, you can go right into the spa, do the procedure. There isn't a lot of downtime. It isn't an operation. And you can get a nice, satisfactory result. However, it will not be permanent. This will last anywhere from around 9 months to a year and a half, depending on the products. And then you would repeat the process because it is a bioidentical substance. So there won't be any allergy to it, but it will self-absorb after time. The benefit of this is it is more permanent, where this will maintain, but it is a little more than just going into the spa. You have to do a little mild anesthetic, and there is a downtime a bit more with this from about 3 to 6 days, where you'll have some swelling around there, but then the blend will be pretty much permanent.
Wonderful. And another common question that we are asked a lot is someone comes in and they say, I have a tired look, but I don't think I need a facelift, or I don't want a facelift yet. Will fat transfer do anything to help me?
We have a case in point that illustrates this beautifully. If you look at this young woman, and she is young, she is 47 years old, and she does have the heart-shaped face on the bottom. She doesn't have jowls. She doesn't really have laxity, but she has a tired look around her lower eyelids and that lid cheek junction is not smooth. It's not more of a full appearance up there. She has also a little bit of excess laxity of her upper eyelid skin that she doesn't like. So she really doesn't need a facelift. What we need to do is fill this area. We did her upper eyelids, removed that extra skin, and then put some fat in on the lower eyelids and cheek. Also, we did a surgical peel there to tighten the skin up. So really no incisions down below the lower eyelids on down, and we did trim up the upper eyelid skin. But you can see now she has a heart-shaped face that we're looking for, and it gives her a more rested, refreshed look. You know, we're eye-to-eye people, so we look at each other in the eyes, and when you get that refreshened, it does make you look brighter. Another example of this, of someone older than this young lady, but still has a little bit of not the heart-shaped face, that tear trough that you see again, and we're going to try to, again, augment that with a fat transfer, fill up her cheeks, and restore the heart-shaped figure we're looking for, and it just gives her a more rested and refreshed look. And the other benefit about this is she's going to age more gracefully because she has that fullness up in the cheek, which will hold that area up on the parenthesis around her, and it gives her a more youthful appearance ongoingly. And we have a 3/4, I think, of her as well.
You know, looking at all of these examples, it almost looks like their skin has a glow afterwards. Does the fat transfer do something to that?
You know, for years, we've noticed that ourselves, and we used to call it a, quote, stem cell effect, because we know there are stem cells in this fat, and that's the progenitor cell. That's the original cell that all things develop from. So when you put this in skin, this has actually now been scientifically proven that it improves the skin because it generates and develops more collagen. So they do, we use excellent skincare that's science-based in our spa, the ZO products. And we've analyzed this and follow it and have been very happy with it. And it really does wonders to the skin. So we always put people on the good skincare program to start with. Now, when we put this fat, we see that radiance and glow that they were getting from just the skincare products, that it looks like that on steroids. It is more of a radiant glow that we are and have proven scientifically attribute to the stem cell effect.
Wonderful. And as we saw before, this isn't a procedure that's just for women. We do have men that are interested in doing this as well.
Well, you know, it's the same exact thing. It's still that heart-shaped face. It's a little bit different, masculine to feminine. But let's show you a case in point on this gentleman who doesn't have the fullness on the cheekbones, and he has that tear troughs around the eyes. So it gives him a tired look again when he's not tired. So going ahead and just going through the needle pricks again, no incisions, and placing that fat into the eyes and building up his cheekbones will give him a more rested, refreshed, rejuvenated look. And here we'll have a post-op on him. And this post-op actually is at week 3. So I tell people you'll get your swelling and discoloration, and this could last. The peak of swelling happens by day 3, discoloration anywhere from 6 to 8 days. And again, usually by 2 weeks, you can be out in the public eye. And you can see him here at 3 weeks and notice the wonderful transformation, and having a tool that we're using, which is his own material, also taking it from his hips where he didn't like it. So getting it rid of there, getting one benefit, and then correcting something that obviously he wasn't happy with.
And that's a beautiful, beautiful result. Now, we started this section by talking about people who were looking tired but not quite ready for a facelift. What if there are people who actually are eligible for a facelift? Can you do a fat transfer at the same time as that?
That's a lot of people ask that, and it is an excellent question, and it has given us as plastic surgeons another tool which really brings this whole thing together, the whole aging process. For years in plastic surgery, we would tighten aged skin. And then we saw we can do things to help rejuvenate it. That's what we do in the spa with the skin cares. That's what we do with the microneedling and the other procedures that we do in there to help maintain this skin. So doing that in conjunction with tightening really added a wonderful addition to it. Now, we also notice that as time goes on, we get deflation of our face, and it takes away from that youthful look. So now we can do a combination of not only rejuvenating the skin by the skincare products and these things we do in the spa, but also we can add fat and tighten. Now, if we look at this young lady, she shows a lot of the different things we're looking at and brings the whole concept of the plastic surgery and MediSpa in a symbiotic relationship. Between her eyebrows, she has the 11s, which we know that's excellent for Botox. You can see the upper eyelid skin. She has laxity and she's lost the fold. On the lower eyelid, she has that tear trough under there, and that's right where that arrow is, that shows that tired look. She doesn't have full cheeks, so she doesn't have the heart-shaped face. She's getting the parenthesis from the nose to the cheek, and then the marionette lines coming down from the corners of her mouth. On her upper lip, she has the lipstick bleed lines, which a facelift doesn't take care of in and of itself either. And you can see the laxity on her neck, where she gets that little, and the descriptive term is the turkey waddle. She gets that laxity there. And on the corners, you can see she has the jowls. So if we're going to put all of this together on her, we're going to have her in the spa. She'll have gotten some Botox in her glabella. In the procedure, we'll do her upper eyelids, fill fat to her lower eyelids and cheeks, and then also do her facelift and peel around her mouth. And this gives her a wonderful, rejuvenated, refreshed look. It almost looks like mother and daughter, and this is the same person here. And she, again, out here is about a 3-week post-op time, but now you can appreciate the heart-shaped appearance of the face. Her cheeks are fuller, nice blend from the lower eyelids. She has the upper eyelid skin refreshed and a nice heart-shaped face with a clean neck. And you'll see this even more represented on a profile view. So we can see her jawline nice and a nice clean drape to the neck. So this is what gives us all the excitement. So we become a tailor in tightening, we become a sculptor in filling, and can do that all at the same time.
That is such a beautiful result. It does look almost like mother-daughter. She looks beautiful.
And even her skin, look at her skin, looks, again, from all the skincare, looks more vibrant than before.
Absolutely. Now we're going to dive into some questions, and we do have a couple that came through. We have someone asking, what if you have more fat to remove than you would reuse? What would you do?
Well, those patients would be a candidate not only for fat harvest, but we could also do the liposculpting or liposuction to those areas of excess redundant fatty tissue. That would be done all at the same time. We would use the 2 techniques that was described. The fat that we needed for transfer would be very delicately removed through harvest technique, and the extra fat that would not be used for transfer would be removed through the standard liposuction technique. That fat would then just be disposed of in the standard medical fashion.
Wonderful. And there was a question that came in earlier, and I know that you responded, Dr. Camp, but I want to be able to ask this on here as well. This gentleman was asking, how does this differ from a stem cell only transfer?
Well, just for all listeners, my response to this question was that fat transfer gives more volume and structural support, It is a strong tissue layer that's placed in the area of transfer, where stem cell is smaller volumes, and it's only a small cell that's placed. But when we do transfer fat, we also transfer stem cells. So not only do we get the sculpting, the increased volume, and the structural support, but we also get the benefits of stem cell response to the skin, which Dr. Lazzaro showed in the last patient, where her skin was just refreshed, glowing, looked 20 years younger or more because of not only her good skin health program, but also the stem cell response of her fat transfer.
That's an excellent answer. Some people ask the same question about PRP. PRP is platelet-rich plasma, which has a healing, rejuvenating effect, but not near as much of the amount of stem cells that you get in fat, and you're getting the volume with it. So it gives you another component, which is a desirable one.
And another great question that came in was talking about the fat transfer to the buttock. Are there different restrictions on that than getting fat, say, in your breast or your face?
Yes, there is. Whenever we do fat transfer, that very fragile, gentle cellular structure needs to be protected, at least in the short term, till it takes up living in the new location. So we don't want this fat site to be exposed to extreme temperatures, not to heat or not to cold. The other thing we want to try to avoid is any excess tension. So if you were to have fat transfer to the buttock, we would not want you to sit directly on your buttock. You would in advance buy what's called a yoga block, which would still allow you to sit, but the weight would be borne on the back of your thighs and not on your buttock. We would not want you to sit in a beach chair fashion, like an easy boy chair or in a recumbent position. You could lay on your side, you could lay on your tummy, but not directly on your buttock. For a minimum of 2 weeks, up to 3 weeks, we would want that restriction to be honored.
We thought for the longest time, this is a little more involved for the post-op for the patient than they would have to do if it was elsewhere. But we've had patients come back, and when they look at the appearance of their buttock, and they said, well, I wouldn't sit on my buttock for 3 months if I had to, so I can get this shape. We thought we were putting through a lot. They said, no, this is absolutely okay.
And for the patient who maybe has a smaller breast, not something that needs lifted or reconstructed, but if they're like an A cup, B cup, and they just want a little more fullness and have some extra unwanted fat, would they be a candidate for this?
The answer is a definite yes for that. Again, and we would show them, here's about how we think we can get you size-wise. If you just want to be a little fuller, can you do that and not have an implant? The answer is yes. If you really want to get a little more projection and still with a natural look, as you know, what we presented in our webinar on breast augmentation just a couple weeks ago, to get that fullness and cleavage in a more pronounced fashion, but natural, the implant really gives us a better tool. But the answer is yes, we can use fat, and we tell them what the pros and cons and limits of the procedure are.
Wonderful. Well, we've had a lot of people that have had this operation, and they have been very happy patients. You'll be able to see from this, if you just read a couple, I'll highlight a few of them. This one here said, I lost years off my face and pounds off my belly. And that is a very common thing that most people will say after this procedure. And it's life-changing. It really is. It takes you from looking, if it's on your face, a little more, much more rested and rejuvenated. So we are lucky that we have these wonderful board-certified plastic surgeons who are experts in their fields, and we really want to offer you complimentary consultations either virtually. We do have a lot of patients that want to talk to us that are out of state, and then they come in, or even in-office consultations. We are starting to do that a little more now with the restrictions being lifted. So if you are interested, please email info@aestique.com, and we would be happy to get you set up either virtually or in office, and you will receive a $500 gift off your surgical procedure. And we have a great webinar coming up next week. So next Tuesday, May the 12th at 1 o'clock, Dr. Lazzaro and Dr. Camp are going to be doing a Mother's Day edition on mommy makeovers.
And this is just exciting news, Brianna, coming out for Mother's Day. We're so looking forward to helping you be the best you can be, to look as beautiful on the outside as you are on the inside.
That's wonderful. That's very exciting. We're looking forward to that. And on our spa side, we have a wonderful webinar on this Thursday, May 7th at 1 p.m. with our nurse practitioner, Marianne Woody, and she's going to be talking all about hair restoration. So it's very exciting, and not something you'll want to miss, and there are some great specials for all the attendees. And also with that, I wanted to mention, we're going to start that following week, I believe it's May the 21st, doing these, instead of doing a 1 p.m. show, doing it at 7 p.m. since people are starting to go back to work. That way you can still attend the live, and you'll be in the comfort of your own home and not having to miss out because of work. So thank you so much to Dr. Lazzaro and Dr. Camp. I hope you found this informative and educational. I know major wow factors with all of these before and after pictures, and I really enjoyed it. And I want to be able to kick it back to you if you want to say any closing remarks.
Well, I just want to thank everyone for attending. We really appreciate and want you and wish you and your family to stay well, healthy, and stay positive. We're all coming back, and let's do it safely.
And thank you also. Continue your COVID-19 restrictions and safety practices. And we look forward to seeing you either virtual consult or face-to-face in person at Aestique Plastic Surgery Associates.
And in close, thank you so much for joining us for this episode of Aestique Plastic Surgeons Spilling Their Secrets on Wave That Magic Wand. Please be sure to follow us on social media. We have Facebook, Instagram, and YouTube. Thank you so much for joining us, and we hope we help you live life counterclockwise. Take care.
Goodbye.